We've done a number of studies, and we've also coordinated and looked at the data from 8 studies across Europe and North America, looking at the sensitivity of HPV versus cytology. It showed very clearly for the first time that cytology is only picking up about half of the abnormal cases where there is a CIN2 or higher disease, and HPV has been seen to be above 95% in many, many studies. HPV has a number of strengths. The most important is that it has very high sensitivity. So negative really means negative, and it allows you to screen less often with more assurance that you've picked up all the abnormalities than with cytology. So most people are going to 5 years or even longer for HPV testing, whereas 3 years is the typical norm, 2 to 3 years for cytology. There is a move now to move with HPV testing to intervals of 5 years rather than the 2 to 3 years that are used most places. HPV testing allows you to be much more certain that nothing is there when it's negative, and allows you to screen less often. So ultimately this is better for the woman. She doesn't have to come so often. She gets more reassurance when she is tested, and it also simplifies the protocol for the doctors. Of the other types, 31 and 33 look to be particularly important and maybe as high risk as certainly 18. 18 is a challenging type because it's not associated with a lot of disease when you find it on screening. There's a lot of false positives, but it does seem to be associated with disease that's further up in the canal, so it might need different kinds of treatment. And that's also true for type 45. So tests that are more specific are going to be more useful, and that's one of the reasons why typing is important. One of the studies that we've done it's actually a series of studies called the PREDICTORS studies, in which we've taken a single sample and then tested them with a range of tests, up to 6 or 7 tests at a time. Those studies identified quite clearly that there are about 5 tests that show good sensitivity, and PapType is one of those actually. Ultimately, what we want is a test that's highly sensitive but is more specific and only suggests women to go to colposcopy if the risk of having disease is high. One of the challenges with HPV is that although it's more sensitive, it's a little bit less specific in the sense that it also picks up infections that are not going to progress, the so-called transient infections. And this either requires repeat testing in 6 months or 12 months' time, or an additional test at the same time. Now, of the additional tests, we think that typing is really important because, for example, 16 and 18 are very high-risk types. We're also finding that 33 is equally high risk, and this is one not usually used. We would say that there are probably 4, maybe 5 high-risk types, 16, 18, 31, and 33. But at the other end of the spectrum, there are 5 types that are really very low risk, and they probably do not need immediate referral for colposcopy. They can be watched with an annual test because the risk of their progression is very low.